So one of the things that I think is interesting in this topic for me is because I've suffered from digital posture dysfunction myself. And you think I'm doing everything I can. I'm training well. I'm sleeping well. I have my stress under control, but I just have so much creakiness and my neck's killing me. Or Dr. Devin Trachman's here to tell us a little bit about kind of the operationally define what this is. We need to understand what we're talking about. And then let's talk about how we can implement some ways to fix this so we can be our optimal selves. Dr. Trackman, thank you for being here.
Absolutely. I'm happy to be here. I think you nailed it with it's very easy for athletes to look strong and fit and be fast, but they can still have these postural impairments. As we were talking about right before we recording this, it can impact everyone. Everyone can be subject to this postural dysfunction, from our high school students to people that are retired or that work in an office all day. So, yeah, I'll kind of get more into the definition of what postural dysfunction, digital posture dysfunction is.
Yeah, let's
It's
do that. Yeah.
yeah, it is the physical changes in your body alignment and your muscle function caused by this prolonged positioning in posture. We typically see it when you're using, digital devices, gaming, laptops, computer systems, phones, and it's not just from scrolling too long. It's our phones go everywhere with us. These digital devices are used constantly throughout the day. And I don't see too many people out in the community walking around with their phone texting like this. So generally, we're at this position here. Some of the
Yeah.
biggest factors that kind of stick out with it are this forward head tilt, these rounded shoulders, and this lumbar, or where your back is in flexion.
Yeah, no, that's a great way of looking at it. And I always, it's funny if you go, I travel a lot, and when you go on the tram in the airport or you just walk around, everybody's in like massive cervical flexion, and I'm just like, and I catch myself doing it, and then I start doing what you said. All right, let me put this up here. You feel like an idiot too. You're like, what am I doing? Putting my phone
People
here.
then kind of look at you funny, or I'll correct some of my patients. I'm half PT, half posture corrector. It's kind of a joke around here. But I mean, I'll have patients, I'll go over actually good posture, and they're like, this feels very weird, this feels silly. I'm like,
Yeah.
it might take a while for your body and your brain to connect that this is actually better form for your muscles, because we develop this habitual new movement pattern.
So let's talk a little bit about the symptomology. So, what are people typically experiencing when they're experiencing digital posture dysfunction?
It can present a lot of different ways, truly. It's not just a neck issue. I've done a lot of research and articles on this tech neck. And while your neck is absolutely affected, there's a lot of other parts of the body that can be too. So some of the key issues are the neck pain, rounded shoulders, that kyphosis through the thoracic spine, or that bending forward, pain at the lumbar or low back. But some of the things that I treat in the patient in my clinic are cervical strains in the neck, headaches, lumbar disc herniation. I'll see reduced rotation through their low back or thoracic spine. And then, really, a lot of issues with hip mobility or glute function. Something else that I treat a lot is this idea of it's gluteal amnesia, or dead butt syndrome, where your glutes are not firing correctly.
Interesting. I actually haven't heard of
Hmm.
that. Can you talk a little bit more
Oh,
about that? Yeah.
absolutely. So, this gluteal amnesia, or dead butt syndrome, is kind of a phenomenon on where people's glutes aren't firing correctly. We spend so much time in this flexed position of our hips. We don't experience that hip extension for prolonged periods of the day, and the glutes are stretched when you're in the sitting position. And not a lot of people are sitting in their chair like firing their glutes, but I recommend it to my patients. I say, as you're sitting down, just see if you can contract each one individually, because if you can't, that's a problem, and we need to explore that. But your glutes are such an imperative part of walking, running, squatting, and then from getting up from your work chair or from the toilet. It's a part of our day to day. And when we lose that ability to fire our glutes, you're missing a huge piece of the overall puzzle, and it contributes to a lot of low back pain and hip dysfunction.
There's also you also I think we were discussing this before, and we're kind of going over this a little bit. So shallow breathing, how does that contribute to
Mhm.
symptomology?
So I always go from, if your neck is compressed, you're shortening all through here. That rib cage is getting compressed. What that's causing is your rib cage to not expand fully. So you're getting this extra pressure through the neck and into your diaphragmatic system to where you're not able to breathe properly. So I always challenge my patients, okay, if you put your hand one on your chest and one on your diaphragm right below your chest, do you feel this arm or this hand moving up more or this one moving? If you're breathing more from your chest, we need to correct that. So, challenging this diaphragmatic breathing from you to be able to use your whole core to keep that strong, because sitting prolonged periods of time, you need a strong core to be able to have proper function. And so the shallow breathing is something where if your system is closed down, you're not able to take those full breaths. And so sitting up nice and tall to where you can really challenge that diaphragmatic breathing. And then if you are in this kind of collapsed position for prolonged periods of time, that's going to change the way your pelvic muscles and all of those muscles that attach down there are aligned. And so that can contribute to all of that gluteal amnesia that I was discussing before.
It just reinforces the point of the kinetic chain and how everything is connected together. But I'm curious too, what your thoughts on this. I guess this is a larger societal question. Is before the invention of smartphones and really just computers and things of that nature, and then looking where we're going now, do you see that there was maybe a point where this started to become a larger problem, or maybe where you started to see more patients regularly
Yeah.
in
Yeah.
this?
I definitely think these are all symptoms of a bigger, more modern problem. These are things
Mhm.
that we are moving less, we are looking down more, and we are sitting longer. And I think all of that is contributing grossly in a very negative way in which our bodies are meant to be used. I saw a big change in my clinic in 2020 with
Mhm.
COVID. More people working remote, going into their homes and trying to set up offices where they didn't have the ergonomic setups. A lot of people would work for 8 hours a day from their couch or from a bar stool in their kitchen, where their feet are kind of dangling.
Yeah.
And then when you're also at home, you don't have that need to get up and have a scheduled lunch or breaks or go interact with other coworkers because you're connecting everything digitally. And so it's created more of a habit for prolonged sitting because there's really not a need to get up. So I think all those things were big impacts for how our society has kind of changed.
Do you think this will become an even greater problem as technology advances, or what do you
Uh,
think?
that is a fear of mine. That is a fear of
Mhm.
mine for sure. And I think it's why we are here today to talk about it. I think it's why it's such an important passion of you and I's to get as many people educated and knowledgeable about this topic. And I think fitness pros are the perfect person to start helping to implement and educate their clients. I know I see, maybe 12 to 15 patients a day, but I mean, that impact is small. But if you spread that out and share this among people, and I mean, it can reach a lot more people.
Yeah, most definitely. Well, this is a good segue into, let's talk about athletes next, and then we'll get into population of fit pros and kind of four tools we can use to help our clients. But when talking about athletes, like and alignment, why does alignment matter for the athletic population specifically?
With athletes, that we were kind of talking about how athletes, they can move, they can look fast, they can look fit, they can look strong, but if their postural impairments are limiting their performance, they are also going to be at increased risk for injury. So it's not just about the fitness level and how cardiovascularly fit you are, but thinking about how your skeleton is stacked, how your joints are being loaded during movement. Those are all very important things. I kind of like to use the example of like a sprinter. You might have really strong quads and really strong hamstrings, but if the upper part of your body is not working properly because you spend the hours in the day, working at a desk, not focused on posture, not strengthening that part of your body too, it's going to have an impact on the longevity of your ability to be a sprinter. It's going to impact those repetitive injuries you maybe see, um, even though your legs are strong.
And it's interesting, I think, for athletes too, we don't often think about them as general population, but they exhibit the same behaviors as the general population. I remember I was watching some podcasts and it was a former NBA player, and he was like, well, the NBA's changed because now in the locker rooms at halftime, all the players are looking down at their phones, and in football locker rooms too. So they're just doing the same thing that the general population is doing. But the look is of someone who is really fit, really
Yeah.
focused, and it has this high level performance, but they're also subjecting themselves to really poor body alignment and issues such as tech neck.
Mm-hmm. Yeah.
So I think it's something that I think we often hold up athletes as a standard of health and well-being, but understand they're exhibiting the same exact problems. And I
Absolutely.
wonder
They're
how deep
just
that
like us.
goes. Yeah.
Yeah.
And they may be affecting their athletic performance by their screen time and things of that nature. Would you think that's a possibility?
I think it's very evident in some of the more recent injuries, using the NBA as an example, the increased risk of Achilles tendon tears. There's a lot more injuries that we're seeing. And I think if you dug deep into it, you could get pretty deep in the weeds on further investigating that.
Oh, you got to let's stop here. I have to hear more about this. What's the connection there? Your thought process about the Achilles tendon and alignment.
I go and I wanna get even deeper, and I wanna look. I always tell patients, they're like, "Okay, I've got a marathon coming up," or, whatever high level thing they're training for, and they're like, what will help me every day?" And I'm like, "Oh, man, I can't pinpoint the one thing." And if I had a camera and could follow you around for the whole day to see how much you're taking in hydration-wise, what are you doing nutrition-wise? I think nutrition is such a key component on things that are going on in our society today, and the
Yeah.
processed foods and the chemicals that are added, and I think that goes very deep. um, just like you said, the training, how much mobility and training work are we doing? Of course, if you're a basketball player, it's important to shoot and it's important to work on specific strengthening, but variety of exercise and training too. I think cross training is very, very important. With working with a lot of athletes that are in the more juvenile ages, we have more people playing baseball, for example, all year round, going straight from school, straight into their summer league, straight into competitive teams, and never really having much of a break. And so, if you're a thrower, the amount of injuries that I'm seeing in patients that are having throwing arms, because yes, they're meeting with their throwing coaches once or twice a week, and maybe they're counting how many throws they're doing and trying to recover, but the second they're done in this motion here, they're going straight to here and here. Like it's this C curve. I
Let's see
give
her.
my male high school patients so much grief about they'll be in the waiting room waiting for me to come grab them, and they're just, I'll say, "Hey, sit up," and I'm like, "You just got 6 inches taller,"
And they're just
you
hunched
know,
over
and
waiting for you.
and then you look at their hamstrings, and the hamstrings are so tight. And so being able to say, yes, you're a baseball thrower, but how are you moving biomechanically from head to toe? How mobile are your hips? How much can you rotate through your thoracic spine? It's so much more about this full body assessment.
I think one of the key things here that, and maybe one of the more powerful, eye-opening things is it's really all the things that you're doing that are not happening when you're training? Like outside of your training, you're thinking, I'm just on my phone. I'm just sitting at my desk. I'm answering
Mm,
calls and stuff. And this doesn't seem like it's part of your potential dysfunction or muscular imbalance. Because we always, I know with my clients, I think sometimes we think we're attributing this to what are we doing during the session? But often a
yes.
lot of my clients' injuries throughout several decades have been the stuff they've done outside of my session, how they're
Hmm.
walking their dog. And okay, I'm just going to get into a pet peeve here. It blows
No,
my
go.
mind when people are walking their dog and looking at their phone down. You're supposed to be with your dog. You spend time with your pet, like walking, being out in nature. Okay, that's just a pet peeve of mine. But
No, I could not agree more. You're out walking and you're still just right here living in it.
right.
100%. And I think too, a lot of people will say, okay, I'm going to work on my posture. If you
Mm,
think of posture as one static thing, like, oh, okay, right now I'm going to focus on my posture, it needs to start as something that's intentional, but it needs to become an unconscious, not an unconscious, a subconscious thing like breathing. You don't have to tell yourself every few seconds to take a breath. It's just, it's natural. It just, your body knows to do it. And so being able to cue yourself and to be intentional with your posture initially, now I can recognize when I start to slouch. And I'm like, oh, I need to sit up tall. So I challenge a lot of my patients. This might take a while. You've trained for years, for decades even, on getting your posture as it is now. It's going to take a while to undo that. Start by setting a timer every 5 minutes, a quiet one if you're in an office setting, so you're not disrupting the whole office, but set a little buzzer. And so every 5 minutes, you're being reminded and you can check yourself. And over time, then set that for 10 minutes, 15, 30, an hour, until it becomes something that you're just more cautious of or conscious of.
it's kind of like on my Apple Watch, it'll buzz and say you need to stand up. But what if there was a
Exactly.
function that said check your posture or think about your posture? That actually could be
Hmm.
really helpful. I want to transition to because this is great. We're just kind of naturally moving into these areas, but you talked about the C curve. I want to talk a little bit more about how can we identify movement dysfunction and what are some other things. So you mentioned the C curve. What are some other things we should be looking for, especially as fitness professionals, when we watch and observe our clients moving?
Absolutely. I think it is so important when you're focused on specific parts. Maybe you're working on an upper body day or lower body day. Just look for compensation patterns. Look for when people could be moving incorrectly. So if you're working on an overhead press, but you're noticing something, they're not able to get that full flexion of their shoulders or reaching all the way up. What's causing that? And dive into that. Don't just be like, oh, that's okay. You're lifting a lot of weight. I'm sure you're strengthening those shoulders. Look for things in ways people could be compensating due to muscle imbalances. A huge part of this postural dysfunction is these naturally attributing muscle dysfunctions and asymmetries, left side to right side. People typically, it sounds crazy, but a lot of people don't have symmetry between both shoulders. One could be lower or more forward. And I say it's not meaning there's something wrong with you in regards to, oh, I need to go see an orthopedic surgeon. I might need surgery on this shoulder. No, it's probably your dominant arm. You probably use your mouse with that arm or write more with that arm. And just
Mhm.
over time, those have developed. Sometimes one side is stronger than the other. Doesn't mean you need different size dumbbells to do your arm exercises. It's just muscle imbalances and asymmetries that happen over time. So I always say, look for movement that looks effortless, like in the wrong places. So if you are bending down in a slouched position and try to rotate your neck, you can't quite go as far. But if
Mhm.
you sit up as tall as you can and then rotate, you typically can go a little further. So just in little tweaks in basic movements, I think that's a huge part that people can look at and help with their training. Looking for early fatigue or burning in muscles. Uh, A lot of times I notice this in rotator cuff and or, scapular muscles. That
Hmm.
upper back on a lot of people is weak when you start isolating specific muscles. The neck muscles, your upper trap, if you start losing mobility in your shoulder, that neck muscle is great to start compensating for more strength and stability in your shoulder. But over time, I mean, that muscle's supposed to hold your head up. And now if it's helping to try to work your shoulder too, gosh, the things that start developing secondary to that, shoulder impingement or frozen shoulder, starting to work on weakness in the rotator cuff, pec tightness. I mean, the list goes on and on.
Is there maybe a simple evaluation that could be done, like just maybe just even not even just that deep, I mean, which is great, and we want that type of stuff, but just maybe just watching your client come walk through the door or whatever, wherever they're at, just watching them move and observing their movement to understand, I'm already seeing some postural dysfunction here to spot it
Yeah.
ahead of.
My assessment starts when they walk in that door and start filling out paperwork. I'll watch how they're sitting in the front office, how they're filling out paperwork. I'll watch as I go and introduce myself and have them stand up. I'll see how they transition from sitting to standing.
Mm.
I'll typically point to where we're going and then say, I'll let you lead and I'll, follow so I can watch them walk into the clinic. And then I think one of the most basic movements that you can learn so much about a patient is watching them squat.
Yeah,
Are
most
their
definitely.
hips shifting? Yeah, like you can
Yeah.
see so much. Are their knees going really far forward over their toes? Do they even have the ankle mobility to do a squat?
Right.
Maybe their form is just, you can see so much from just a basic squat. And sometimes, especially if it's a patient who I'm like, if I say the word squat, they're going to run out of here. I might say, okay, I'm going to have you have a seat in this chair.
Yeah.
And then they can sit, and you can still pick up a lot from just a sit to stand transfer.
I do that. That's a big assessment for me is a sit to stand transfer, just understanding also the psychological aspect of how they feel about sitting and standing. Because
Mhm.
a lot of clients and a lot of people have not seen the ground or close to the ground in a long time, unless they've
Yep.
fallen to the ground. It's not usually a voluntary reason to go towards the ground. And so watching someone move their body towards the ground in a sitting position and getting them to move towards that is just a tremendous assessment. I agree. I never say squats with clients like down the road I will as we have
Yeah.
progressed much further. But in the beginning, like, I just want to see you sit down. Like what's
Mhm.
happening when you sit down, and it's often incredibly mind blowing. It's like, whoa, this in my mind, I'm thinking, this is how you sit down in a chair. Like
This
it's
is how you're
wild.
doing this
This is how you're
all
doing it.
day, every
This
day?
is how you get down to pick something up off the ground, which is another assessment I do regularly. I'm like, whoa,
Yes.
tremendous compensation on this. So great assessments to do.
I actually, using that example right there, I had a patient, I was trying to explain how to perform like a single leg RDL yesterday
Yeah.
or a golfer, and it was not clicking. And so I was like, okay, what if I put this I just grabbed my little timer and put it on the floor. I said, "How would you pick that up?" And then he just immediately could do it. So
Yeah.
sometimes taking sometimes not everybody is familiar with exercises or movement patterns. So if you just make it a functional movement, it's a lot easier to see how they would do things functionally in their day to day.
Most definitely. So let's move into for our audience, are four simple tools that Fit Pros can use to implement with their clients today. I mean, anybody listening are Fit Pros and clients listening too. It's going to be great for you to listen to some corrective strategies, training tips they can use literally today after watching this that they
Yeah.
can implement with their clients for this.
Absolutely. And I'm such a huge proponent. I say fitness pros are often like the first line of defense for this. You don't have to be a physical therapist to spot these dysfunctional movements. You just have to know what to look for and how to help, them correct it. Kind of my four things. I'm huge on education because, like you said, a patient will come to you and maybe they have an hour session. And so they're intentional about that for that 1 hour. But what are they doing for the other 23 hours in their day? You've got to give them things that they can work on at home. So educate why it's important, why this matters. We know most fitness professionals are going to know why posture is important, but you've got to make it reasonable for the patient or client to care. And if you talk about, I'm worried how you'll move at 60, I'm worried how you'll be able to bend down and pick something up. If you can show them some weaknesses or areas in which they are not performing at up to par, it makes it more meaningful to them. And then consistently, daily movement routines rather than just these occasional hard workouts. So things that they can implement every single day. So my 4 tips kind of for corrective strategies and training tips are work on mobility. This is going to be making sure their mobility from the thoracic spine to the neck, the hip flexors, and a lot of that posterior part of your neck are those cervical extensors. We've got to train those. And sometimes patients look at me like I'm crazy when I'm giving them exercises, that incorporate this double chin movement, but I'm like, this is going to help you. Are you sure? I don't want a
Feels
double
weird,
chin.
like you're doing, that particular movement. I think there's a vanity aspect to it. It just seems to
Absolutely.
look
You
like
look
it.
kind of crazy doing some of this
Yeah.
stuff, but listen, you look crazier when you're walking around with this horrible posture.
I think
So
you look
number
crazy when you're
1,
looking down, walking across the street, and not paying attention to your environment. That's crazy to me.
or
Like,
the cars
yeah, I'm
yes.
like,
So number 1, I definitely say mobility has to be first and foremost. And then going into that second corrective technique or training tip would be activation, knowing how to activate the muscles that are needed. So those deep cervical neck flexors or those muscles that allow you to do that retraction at the
yeah.
chin, uh, your glutes. Those are so imperative for your posture, and then that whole posterior chain, all the way from muscles between your scapula, those muscles for the low back, and the backside where of your core. All of those lumbar extensors are extremely important.
Most
After
definitely.
activation, yeah, so we've done mobility, we've looked at activation. Now we need to look at reinforcement, functional patterns that train under loads. So this is where I really get into you need to be cross training. You need movement variability because what happens right now is we go from sitting at the office to sitting on our couch at home. We're not doing a lot of movement variability. So how can we cross train? If we're doing a lot of hip flexion and then you're going to the gym and you're riding a bike, we're still in flexion. So change up your patterns. If you do have a position where you are sitting more of the time, let's really focus on training those hip extension movements, those hip extension movement patterns. Let's really working on that core and thoracic mobility if you're primarily in one position for most of the day. And then my 4th, so we've looked at mobility, we've looked at activation, we've looked at reinforcement, now behavior changes. This is giving your clients those tips and tricks for, okay, what can they do to change the behavior? They're not going to quit their job. I would never encourage a patient, oh, you're sitting for 8 hours a day, you got to quit your job. No. What kind of movement or behavior changes can we make so that you can continue doing that job for as long as possible without developing more dysfunction in your posture? So screen breaks, looking at ergonomic tweaks. So what about a standing desk? What about being able to get one of those walking pads or bikes that you can put under your desk? Making sure you are setting those timers for some posture checks. And then kind of like those little movement snacks. Like, what are you doing in regards to your vision? Is there something, if you catch yourself leaning forward to see something, can you do some blue light blocking on glasses? Can you get your screen up higher? Visual resets also, because if you go from your computer screen to your lunch break where you're then on your phone, you're not giving your eyes that break that they need either. I
These
call
are
that
great
screen
tips.
hygiene.
Screen hygiene. It's everything's
Yeah.
hygiene now. Sleep hygiene, screen hygiene. That's
Yes.
awesome. It's much like
Yeah.
just hygiene in general. Obviously, it feels natural for that. One thing that really resonated with me is I think about on reinforcement part. I want to dive a little bit
Mm-hmm.
deeper in there, just as kind of a commentary. And I've thought about this pretty deeply. Is that even when we're really consistent exercisers and have that experience, we often go from sitting in a desk and then we go to a gym where we're also just stationary at the same time.
Yep.
There's most exercisers have very little movement variation because they're often doing a very similar program. All right. And that program
Yep.
often is very stationary, very much in a square. And and now where I'm seeing something I think is actually pretty I'm going to say disturbing. Maybe other people would think it is, but and I kind of did this with an episode, my previous one about footwear. I'm seeing a lot of
Yes.
postural dysfunction, but also combined with people wearing really poor footwear when they're lifting, such as Converse, Chucks, or nothing. And so they're actually from the feet up, they're already causing postural dysfunction by the shoes they're wearing, plus standing in place while lifting and never having movement variation. What are your thoughts about that? What I just said?
I mean, my thing is again, I don't want to, if you love cycling and that is your favorite form of cardiovascular exercise, okay, great. But if you are going from sitting to then sitting at the gym, we've got to incorporate something. So we've got to incorporate hip extension. So I think you've got to have variability. And that's where I think it's imperative, if you don't have the education or the background to know what you should be doing, this is where you need to be reaching out to your fitness pros. You need to be meeting with a personal trainer, seeing your physical therapist so that you can really isolate where your balances are, where your imbalances or asymmetries are. A lot of people, just like you say, all right, I'm going to go to the bar and I'm going to do these movements. If you're just doing squats and RDLs and you're just doing this hip flexion,
Mhm.
like we've got to challenge, we've got to incorporate more hip extension and more postural chain. If for men, for example, if you are at your desk in this rounded shoulder position, and then you go to the gym and are really, really intentional about your chest days, but not on your back days, you're missing a huge thing because you're just causing more tightness and more strength through those pec muscles to keep everything more rounded. Women, a lot of times they're kind of fearful of, well, I don't want my neck muscles or my upper traps. I don't know if you've heard of this, but women getting Botox in their upper traps.
What? No,
Yeah.
I have definitely never heard of that. Tell me more, please.
Okay. Okay. This, oh, I might go viral for this one. So women are, they want to have this long neck appearance, and so they'll do these injections in their upper traps to get this longer, elongated, thinner, slender neck. And as you know, Botox deadens the muscle. And so it is allowing the neck stabilizers that help keep your head up to not work, to
Wow.
paralyze the muscles.
Jeez.
And so, I have friends that reach out and say, "What do you think about this? Like, I like cosmetically what this looks like." And I say, cosmetically, you might like the way it looks, but you're not going to like some of the secondary impairments that are going to come from this long term. The issues of then having to deal with headaches or migraines or instability in that cervical spine, the increase in muscle compensation that's going to develop from other things trying to then engage and help hold your head up. It's one of those things I don't think enough people also realize. Your head typically is around 11 to 13 pounds. And there is significant research out there that for every bit of forward flexion that you do, that is more pressure that's going through your spine. So even
Mm.
if your neck is just at a 45-degree angle, if you're at a typical 11-pound head, that's 49 pounds of pressure being exerted through your cervical spine. And your muscles, like your upper trap, are helping to keep everything stable and moving properly. So again, I always encourage women too. It's important for you to have stability and strength in your neck. I encourage my athletes. The stronger your neck is as an athlete, it is going to reduce your chance of concussion. I think it's like
Ooh.
for every I, I could be incorrect in this, but I believe it's like for every pound of for every bit of muscle, like pound of muscle you have, it's like less percentage of concussion. I'll have to go back and look at that
Yeah.
statistic. I can't remember it exactly, but
So would you say like exercises that involve cervical rotation, retraction, protraction, things like that would pretty key for that, or having this doing this under some version of external resistance would be helpful. Kind of break that down a little bit. I know we talked a little bit about this, but maybe some really specific things that can be done
yeah.
for them. That's a pretty incredible stat to talk about. I mean,
Yeah. Absolutely. And so like your soccer stars, like if they're not out there, the goalies that are out there using their necks, and if you've got a son that's playing football and you want to reduce chances of concussion, like they need to be really focused on posture and their strength in their neck. Some of the basic movements I'll typically start out with because again, not every patient that I treat throughout my day is an athlete. Sometimes they're just coming from an office and they haven't worked out in 10 years. And so it always depends on level of where meet a patient where they're at, meet a client where they're at. So it might start with just laying on their back on the table with a pillow underneath their head and seeing if they can squish that pillow. The number one thing I
mm,
seek when compensating for trying to get those cervical extensors to engage or those deep neck flexors to engage is this just drop. They'll just drop their head versus actually pushing back. So if we work first on that movement where nothing is impairing them, they've got gravity to assist in that head, then we'll go into all right, now let's try it seated or using the wall behind them as a way to push their head back and they can get a tactile sensation
mm,
from the wall. Then a lot of times I keep these everywhere. Resistance bands, you can put that resistance band behind your head and have them do it against resistance. And then you can start doing different positions. You can have a patient go quadruped or on hands and knees with that same band and then have to do it against gravity. Lots of good ways to work on strengthening those deep neck flexors.
that is awesome. I mean, I just don't think we think about the neck enough.
Hmm.
But so many people are experiencing pretty tremendous neck pain. I can speak for myself. I've definitely had that issue. And it's an area I need to get better on. But I could tell you one thing that really changed my training business was I was a collegiate track and field athlete, and and any of my track athletes out there know you do a lot of hip drills, tons of A skip, B skip, ACA, and I started thinking to myself, I need to incorporate this into my business. And I started this like 20 plus years ago. So all of my clients as a baseline get lots of the hip complex. They get hip flexion, extension, rotation, abduction, adduction, and while moving. And it's often the first time they're ever introduced to these movements, especially for my clients who are already previous exercisers. They're used to a very basic level of exercise, which involves just lifting heavy, shoulder press, chest press, squats, bicep curls, but they don't move, they don't do anything with their hip complex. And I've actually had several
Yes,
clients who have very severe knee issues. And when we focused on strengthening and adding endurance in their hip complex, their knee pain went away pretty
it's
immediately.
amazing.
Isn't it incredible?
It's
And
incredible.
it's incredible. Like they just ignored their hips completely, you know?
Yep. And it takes also that time to educate and explain the knowledge behind, well, if it's my low back that's hurting, what do my hips have to do with it? Or if I have knee pain, why am I working my glutes? I joke with my patients, I'm like, if you ask me after one or two sessions with me why we're working on your glutes, I haven't done my job. Like it's it's so important for the other things, the other body parts, and every single patient that has chronic low back pain, we are assessing their hip mobility
Yeah.
because they are generally tight in internal or external rotation, one of the other things. And it's kind of a, pet peeve of mine. Stretching is great. I talked about it earlier. Mobility, stretching, it's phenomenal. But is it just a static stretch that you're giving your clients or your patients? Or, I think a hamstring stretch is great, but how are they gonna apply that in their day-to-day routine? A static hamstring stretch versus like a straight leg RDL,
Hmm.
where you're actually now more functional with the movement. I think try to get these exercises more dynamic. I love the fact that you're getting your patients more dynamic in
Yeah.
endurance and mobility. It needs to be functional. And I think the more that you can get a patient off the table or off just laying on the ground doing static movement and make it functional. If they've been sitting all day, the last
Yeah.
thing they need is more static movements.
Exact. And so this is a big part of my practice is that, especially when I do an intake with a client, is like we're moving the entire time, not stationary, which is probably what you're used to, going somewhere to be stationary. We move the entire time, and we're moving, especially in the beginning, a lot of that hip complex movements and the shoulders. And I always explain to them that because these are two of your most lax joints. So you
Yes.
sacrifice stability for mobility in these joints. And often a lot of issues come from these areas of the body. So we need to build a good foundation with our hips and our shoulders because just wild movement variation.
Yes, yes.
Yes.
I always say, like, we scroll more than we squat, but, like, we are built,
And
we are
squat.
meant for movement. And
Yes.
so get off the phone, get off the chair and move all the hours of the day that you can. Um, be more than sedentary. Make even when you are sedentary, try to get mobility in there. I'll teach my patients different hip mobility work they can do from their office chair. I'll say, take a picture of your office setup for me so I can show a little bit more of how you could implement movement into the space that you're in for, 6 to 8 hours a day.
Yeah.
We are in a position to where we can retrain this and we can make this epidemic, which is truly what it is, this sedentary epidemic, where we can get it course corrected to where we do encourage longevity and movement.
Most definitely. I have to say, this is just chock full of amazing information. Dr. Trackman, this was just amazing. I really appreciate
Awesome.
you giving me your time. I know that everyone is really busy, but when we give each other time to talk about these things and it gets out to a lot of other people, then all of a sudden it starts making a difference. So thank you for the difference you're making.
Oh, absolutely. I have thoroughly enjoyed this.
Awesome. Well, tell everyone how they can connect with your work. We'll have a lot of notes in the show notes about you and connections and stuff. But if you'd like to shout out a little bit some other ways people can connect with you, please let them.
Absolutely. I am local to Oklahoma, but I am all over social media. I am a big, oh, I'm sorry. That's my therapy dog, Dimmy. I'll introduce her real quick.
Awesome.
She comes to work every day with me. I don't know if you can see her there,
That's
but
awesome.
she's our little therapy dog here. But yes, you can locate me on TikTok or Instagram at Devin Trachman _ DPT, as in Doctor of Physical Therapy. And like I said, I am local to Oklahoma. I have a clinic here, Physical Therapy Central, and I'm located in Edmond. And I know we'll link all the different links in your bio.
Awesome. Thank you so much. I appreciate
Yes.
you, and we will be in touch.
Awesome. Thank you, Dr. Parker.